Hi, and welcome to A View from the Bed. This is the CHI St. Vincent podcast where we talk to real patients about their healthcare perspective. We know that your healthcare journey can be scary, so that's why we want to get their view on the good, the bad, and the ugly from diagnosis to recovery. Enjoy today's episode. Hi, and welcome back to our podcast today, A View from the Bed. We are talking to Ann, and Ann has a really interesting story for Heart Month for us. So she had a heart ablation, and as you can see, Ann does not look like your stereotypical heart patient. And so we're very excited to talk to you today, Ann. So first of all, tell us where it all started for you.
I would say in my early to mid 20s, I started feeling sped up heart rates, irregular heart rates.
Okay.
And they happened often enough that I thought it was kind of weird and it feels kind of scary. And so I went to my PCP. They put me on a Holter monitor and they said, oh, it's just some, like I said, irregular heart rates.
Yeah.
They're not dangerous. Everything's fine. Decrease alcohol, stress, and caffeine. Okay, great.
Yeah.
So, like we all should, right?
Yeah.
So I would decrease those things. I would feel better. And then they kind of sneak back in. And so then I would feel worse again. And so this went on for probably 10 years. I mean, just on and off, back and forth. Had 2 pregnancies, never had any problems while I was pregnant. Like, just, I was told it wasn't dangerous. So I just didn't think a whole lot about it. And then you turn into the typical mom response. You're going to take care of everybody else.
Yeah.
They became more frequent. They would last longer. I would have episodes that would last hours and hours and hours of my heart racing and going in on a regular heartbeat. It was really scary.
That is.
But it would stop. And I knew how to, if I would go to sleep, for some reason, if I could go to sleep, it would reset. And so I just kept trying to make it go away myself and make it go away myself. And so I had it for a long time. And then one of my soapbox things is to always give blood if you can.
Sure.
If I don't need it, let's share it with others.
Let's share it with others.
At work, they had a blood drive, so I went and gave blood. And then I came, and I'd never had any trouble with it.
Okay.
And came back to my desk, and I had an episode. And so my heart is racing.
Yeah.
And it's having irregular heartbeats. And I'd just given a pint of blood. So imagine going and giving blood and then going for a run.
Yeah, that's scary.
You're not going to feel good.
Yeah.
And so I started getting really dizzy. I started blacking out. I'm at work. I'm at my desk. So I have to go in to tell my boss, who I've never told about any of this before, and say, I think I need you to take me to the emergency room. I don't feel good. And kind of told her what was going on. I called my husband, met us there. They brought me back. Did triage. I sat there for a few more hours. My heart's just racing. I call it like a flopping fish. Like it just, it's flopping around in there.
You can literally feel it.
You can feel it. Yeah. And so, and I don't know what happened, but as soon as they called me back and I laid down on the table for them to put the monitor on me and the EKG stickers on me, stopped. So they couldn't tell what was going on. But one of the questions they said when they were checking me in was, who's your cardiologist? Well, I don't have a cardiologist. I don't go get this checked out. It's just something I've lived with. Not saying that that's what you should do, but that's what I did.
Yeah.
So we waited and waited for many hours. And finally we just left because we never actually saw anyone. And I was feeling better.
Yeah.
So I just went home. I got some rest. Went out with a couple friends a few days later for lunch, and I told them what happened. And I said, I guess I just need to call one of the other hospitals here in town and get an appointment. And my friend said to me, no, St. Vincent's has the best heart program in town. That's who you need to call.
Yeah.
We're going to find you somebody to go see.
Yeah.
So I got a recommendation to go see Dr. Chaka.
Okay.
And got an appointment pretty quickly. My husband went with me because, 2 sets of ears is always better than one. And I was feeling nervous.
I too.
Yeah. So had a fantastic experience with him. He put me on some medication and said, okay, well, first a heart monitor, was on a couple different kinds of heart monitors.
Okay.
So that he could see what was going on.
Okay.
Again, same answer, which was they aren't dangerous.
Okay.
But they're scary and annoying and you don't like it. So got put on some medication.
Okay.
The medication helped, but I was on medication every 12 hours.
Oh, wow.
I don't want to be on medicine all the time. And
That's
so
a
I
lot.
did that for a year to 18 months.
Okay.
And finally, when I first saw Dr. Chaka, he told me about the ablation and that would be an option eventually if the medication didn't help.
Okay.
The medication did okay, but I was also tired of being on medicine all the time.
Sure.
So I went in and talked to his nurse practitioner
Okay.
at my next appointment and told her, it's doing okay, but I don't love being on medicine all the time. And I'll never forget this. She closed her laptop, put her hands in her lap and said, let's talk about the ablation. And I was the only person she was concerned about. And it made all the difference. And I was able to ask all my questions about the ablation. And she gave me her full attention. And I had a really good experience with that. So next thing I know, we get the ablation scheduled. I'm here at 5 a.m. on the day after July 4th. So yeah. Get checked in, and everyone in the heart cath center was lovely and helpful and kind. And I was nervous and, read and Googled all the things. And Dr. Google. And had the ablation. And the hardest part, I think, is you have to lay completely flat for 4 hours afterwards. Yeah. And so that was kind of hard. And the nurse came in and told me that it wasn't as not dangerous as this. They had thought that I did have AFib.
Okay.
And so they had discovered AFib. And so I was going to need to be on more medication for a while after the ablation. And they told me that they had found AFib during that ablation. They walked me through how the recovery was going to be different than I had expected.
Okay.
Thank goodness, again, for my husband being in the room because I'm laying flat and just waking up from anesthesia.
Yeah.
And they're telling me all of the different things. I think the biggest thing was that I was going to be on a blood thinner.
Okay.
Which has some major effects on a lot of things, especially for females, which I did not expect.
Mm-hmm.
And so I was going to need to be on blood thinners indefinitely. I didn't know how long that would be. They said hopefully a few months, but I didn't know. Mentally, that was kind of hard. It made me feel old and made me feel like there were a lot of feelings there.
Yeah. Because you think the blood thinners, like 75 plus.
Right. Yeah, right. So knowing that now I have AFib diagnosed, which they fixed in theory in the ablation, but now we have to go back and do more heart monitors. And really, like I said, I thought I was going to be done.
Yeah.
And so now I'm on blood thinners. Now I'm going back to see Dr. Chaka more often.
Mm-hmm.
So yeah, it was not what I had expected. I was hoping to be done.
Yeah. It became a journey.
It did. It really did become a journey where I thought I had already finished the journey and this was the end.
Yes.
And we were still in the middle of it.
Yes.
So, yeah.
Well, and to your point, that's where it's good that you mentioned, you had your husband with you. And for a lot of these procedures, you'll be asked to bring someone, but it's really important you bring somebody you trust, not just a driver.
Right.
Because sometimes if those things occur, you can you need that emotional moment.
Yes.
With that person. And so making sure that you have somebody there that, really can help you through that emotionally, I would assume is really key.
Yeah. And he's real good about thinking on his feet and asking the questions right then. And I have to process. And then my questions come 2 days later.
Yeah.
And he was on it and is really asking all the questions that I couldn't think to ask in those moments.
Sure. Well, and sometimes when you're the patient, it's a lot harder to think of the question because it's your body. You're processing what just happened to your body. And for our viewers, just so they know why you had to lay flat for 4 hours. So when they do an ablation, they do it through a cardiac catheterization, which is where they run a very small wire through your groin most of the time. They can sometimes go through a wrist, but a lot of times our arteries in our wrist are not large enough, so they have to go through your groin. And so when you're done, you have to lay flat so that groin area does not bleed. So that is why Anne had to lay flat for so long. So if you have a parent that you've heard is going to have a cardiac cath, Same thing. That's also how they do stents, is through a cardiac cath. So that's when Ann said she had to do that. That is why. Not all of our procedures require that, but this specific one did require that. So did you know that going in? Hey, you're going to have to lay flat for 4 hours?
Did. Yeah.
Okay.
I did. And there wasn't a lot you could prepare. Like, I can't read laying flat. Like, my husband had the TV on, and as best he could, it was kind of hard to see. Like, we were prepared, and that was just going to be the tough part.
Yeah. You're just going to lay there and look at the ceiling and hope it's a nice ceiling.
Yeah, and hope it's a good ceiling.
It's a good.
So the next few months were harder than I anticipated. I think mentally I was ready to be done.
Sure.
After the surgery, and I wasn't.
Yeah.
It took longer than I had expected because they had found AFib, and that's not what any of us were expecting. So, but now I still take one medication, but it is far more controlled. I don't have those scary, long episodes.
Good.
I still see Dr. Chaka once or twice a year.
Okay.
Still wear a heart monitor every once in a while to check and make sure that everything is okay.
Yeah.
So now that I've had the ablation and I'm feeling so much better, it makes a big difference for my anxiety and just the relief of knowing I'm not going to have those long episodes of my heart racing and those arrhythmias happening, especially after I had my kids. It was scary. I remember one night being home, my husband was out of town, and it was just me by myself, and my heart was racing, and it was really scary. And now, even though I have a blip here and there, it's a huge relief knowing that I'm healthy.
Yeah.
And those aren't going to come back.
No, I could definitely imagine that, you know, when you know what's going on with your body versus not.
Right.
There's always a fear. And that's why it's so important, like we talked about earlier, of paying attention to your symptoms and signs. Because if it doesn't feel right, even if it is gas, go to the emergency room. You know, I hear all the time, or my mom will even say, "Oh, I don't want to go. It's probably gas." Well, go anyway. We'll be totally fine if you just have to toot. Like, if that's all it is. But if you're not sure, go to the ER. And trust me, in healthcare, if that is all they see in the ER, they are so relieved.
That's a good day for them.
Yeah, grandma just had too many beans.
Yeah.
That's okay. But go if you're not sure. Going back to when, you know, you realized your arrhythmias were becoming a little more frequent, was there anything that you were really hindered from doing, or was it sporadic? Did you notice, oh, if I work out, it's going to start, you know, palpitating or flopping around, or sometimes could you work out and you were fine and then others not fine?
It was sporadic other than those three things: the stress, the alcohol, the caffeine.
Okay.
Like, too much of that, I could see a direct correlation. But otherwise, no. They really seemed sporadic.
Well, and you brought up a good point too, because one of the things and one of the myths we're trying to kind of bust for people in the cardiology world is you can have and see an electrophysiologist, and you can also have and see a cardiologist.
Yes.
And they work hand in hand. So to break it down just a little bit for our viewers, and a cardiologist, we like to say, is our plumber. You always hear about someone that has clogged arteries, or they need a bypass surgery or a stent. Those are things that a cardiologist and your heart surgeon work together on, and they really clear the pipes like a plumber, okay? An electrophysiologist, we like to call our electricians, because our heart's rhythm is an electrical beat. And as Ann was describing, when your electrical beat gets out of cycle and starts racing, or it can go the opposite and go too slow, where you might need a pacemaker, that is what your electrophysiologists do. So when Ann is talking about AFib, you can have a small arrhythmia and not have AFib, like Ann said, But AFib, if it is diagnosed, is a lot more dangerous, and they like to do more surgical type interventions to try to solve those, because sometimes the oral medications for those aren't as good as some of our surgical procedures now. So that's amazing that you wanted to talk about an ablation, because otherwise it could have went undetected for a little bit longer.
Absolutely. Yeah.
And so how are you feeling now?
Feel much better. I still have a few flickers and flips here and there, but nothing like was lasting hours and hours and long episodes. And
Good.
I think a lot of the fear is gone. And so that's something that Dr. Chaka and I talked about, especially in that first appointment, is that it happens and then you get anxious, which makes your heart race more, which makes you more anxious. And he said that especially for women. I mean, we worry about things, especially now. At that point, I had my children. So then you worry about not being here for them and all those things. And so they fed each other, that fear and that anxiety. And I don't have that as much anymore. Even when I feel a little flip, I know that it's just going to be for a second and we move on and it's okay. And like I said, I go see Dr. Chaka once or twice a year. He checks a heart monitor and everything's fine.
Everything's good. Well, and you brought up a good point too, especially as females, but even our men, you guys are not great about going to the doctor unless you're dying. But, you brought up a good point of you had talked about it with your PCP, but you had never, and your PCP had never made a conversion to a cardiologist. And sometimes, as owners of our health, we have to do a timeout and say, this isn't really well controlled. Like, what are some next steps? But we're afraid to.
Absolutely.
And sometimes you don't kind of want to know the answer, right?
Right.
It's like,
Yeah.
Nobody wants to say, oh, you're going to have a surgery where you're going to have to, be cast and laid out for 4 hours.
Yeah.
Because we're like, oh, well, I've got to do laundry and pick up the kids and go to work. And you have all those timeout. And so it's really easy. So what advice would you have for someone that maybe it's not a rhythm issue, but maybe it's just something they're just not feeling right? Well, what advice would you give to them?
Don't wait. Don't wait. Go get it checked out. And get it checked out once a year, even if they tell you it's okay. I got told it was okay, so I didn't do anything about it for 10 years. Yeah. Because I was told, cut those things out, and I did, and then I feel better. And so I felt like I had it under control. Yeah. And I didn't. And so just don't wait. Go get it checked out. Take care of yourself. Go to your annual appointments, and don't wait.
Don't wait. Well, you heard it here. Do not wait. And another good point you brought up too is if you're experiencing any of those kinds of things regularly, it's probably good to tell people around you. For example, at work, like you had mentioned. Yeah. Because that way, if you were to pass out, they would at least know, hey, she says sometimes her heart flips in her chest. Yeah. And so I think that's another takeaway for our viewers, and is just share with people around you when you have something regular going on as a backup. Yeah. You just never know.
Yeah. My husband knew, but I had never mentioned it to anybody else.
Yeah.
So
was there a family history of AFib or arrhythmia?
No.
You just were lucky.
Yeah, right. Just drew the straw. Right.
Did they say that now that you have kiddos that it's something that could be a genetic or not? Have they said anything about that?
So one of my daughters takes a medication that, with a family history, now that she has a family history of my arrhythmias, that she needs to get that checked out. So she's gone and gotten checked out twice, I believe now, just because of a medication that she is on. So they need to be aware that they have a family history. And so I made sure to mention it to their pediatrician. Oh, yeah. And so their pediatrician checked their chart and said, well, because she's on this medication, we want to be sure that we get this checked out every once in a while.
Yeah. So, that's great to know too, is once you're diagnosed as a parent, sometimes it's hard to remember at your next kiddo's appointment. Just put that on their paperwork that there's a family history.
Right.
especially if they're young kids.
Yes.
And not old enough to, if you have adult children, definitely tell them to. But, especially if they're small children, it's easier to forget to do that. Well, your story, I will say, Anne, is just amazing because you're not what a lot of people think of as the stereotypical heart patient.
Right.
And so I think that's a good reminder that heart health can happen to anyone, especially if you do have a strong family history. But in Anne's case, if you don't have a strong family history, it can happen at any time, at any age. And to really pay attention and talk about symptoms with your provider. And also know you have resources of cardiologists and electrophysiologists that can help you with these things.
Yeah.
Well, do you have any kind of final thoughts for our listeners today about your story?
I don't think so. I had a fantastic experience at St. Vincent's. I had a really great experience with Dr. Chaka and all of his staff. His nurses call right back. Just a really fantastic experience with everybody.
Well, wonderful. Well, we love to hear that. But more importantly, we love to see you're doing great. We love to see that you're able to live a more healthy and better life.
Yes.
Hopefully you're able to ingest a little bit of caffeine. A little bit, moderation.
Yes.
Maybe a cup of coffee. Because that's what's important. So thank you so much, Anne. We appreciate it. And guys, until next time, we're going to be talking about a fun topic because it's going to be Colorectal Cancer Awareness Month. So come back. We'll learn more about some of those fun GI things. So until next time. Thanks for joining us for today's episode of A View from the Bed, A Patient's Perspective. We hope that you found it helpful. We hope that it helped you make your healthcare decisions. We hope that it made you feel a little more comfortable with your own journey. And we hope that you'll join us next time.